You know, it's hard to believe. 18 months into this, and still having a problem now with a new Delta variant, a viral mutation, um, suspected to be a new pandemic of COVID 19. Let me say, I think the problem is that we're doing things that are not useful. And we're getting our recommendations from sources of information from either State Board of Health, the CDC, NIH, which is contradictory to all science, and the campaign leader, a guy in Washington, I'm not going to say his name. Um, these states and federal bodies are from whom we're getting all the advice from, and actually, they don't even bother to read the sciences and factual studies they paid for, or rather, we paid for with our tax as taxpayers, right? Before I possibly tank my entire career here, I want to explain. I've been in the sciences for 27 years, specifically in chemical engineering, mechanical engineering, nanite sciences, nano formulations, and in the last 9 to 10 years in plant based sciences, plant based products. In the last about 3.5 years in the CBD industry of hemp, um, all for healthy living. And for the last 12 to 14 months, I've been following the studies that are published, and I've studied the immunology and the sciences that were back for the vaccines that are offered today. And you would be surprised when you ask a biologist in big pharma um, just how they open up and start sharing just really should be private stuff. I'm actually, to date, a functional biolaboratory scientist, and I'm not a medical physician. That means I'm not trained or specifically trained in immunology or inflammation regulations. However, at my disposal, I have many, many immunologists and virologists and primary care physicians that contact me on a regular basis, not only nationally but worldwide, to discuss the products we have at TM Biotech, and specifically the formulations of our plant based organic products for their patients, either systematic with COVID 19 or post recovery, to get them basically back in shape. And with these professionals, they're showing 100% success in treating of the symptoms of COVID 19 as a prophylactic, or during or post symptoms of COVID 19. You know, in my opinion, and most of my colleagues, everything being recommended by the CDC is not pure science, and we're not getting our sources of information from specially trained immunology and inflammation scientists or virologists within those organizations. They're just kind of like spouting off whatever comes to their mind, kind of like what I'm doing now. And everything being recommended by the CDC and the State Board of Health is actually contrary to all rules of science. They seem to be ignoring the very science that they paid to have done. This is why we keep struggling with this, because with COVID 19, because you cannot make these viruses just go away. The natural history of all respiratory viruses is that they circulate all year long, waiting for our immune system to get sick, uh, mostly through winter, or in these cases, become deranged, as what's happened recently with these fast track vaccines. I truly suspect the cause of this new symptomatic variant disease is twofold, because the viruses cannot be filtered out. They've told us, of course, social distancing and wear a mask and wash your hands and general hygiene. But social distancing maybe it helps a bit, but using a mask not so much. It really doesn't matter how many layers of cloth and paper you have covering your face. It's a virus. It's submicroscopic. I'm not saying don't wear a mask because psychologically it gives you some awareness of your surroundings and forces you to social distance and pay attention that you're not licking the handrail as you walk into Walmart. But submicroscopic means it cannot be seen through a normal microscope. So let's kind of recap. SARS-CoV-2 novel beta coronavirus that was identified in human patients happened from Wuhan, December 2019, and has resulted in a global pandemic, an unprecedented public health emergency, and untold economic and social repercussions, basically worldwide. Um, these are the ways that we were similar to the 2002, it was 2003, the severe acute respiratory syndrome, SARS, the SARS epidemic, whereas the live animal market and hundreds of animals and hundreds of animal species were sold, and it was suspected to be associated with the emergence of early spread of COVID-19 in humans. This thing has been around for a while. Although COVID-19 is novel in the breadth of the human outbreak, several pathogenic alpha coronaviruses and beta coronaviruses have shown very, very similar patterns of emergence. Now, and let's go way back. 1930s, coronavirus pathogenic associations to livestock, companion animals, your dogs, your cats in your house, and laboratory animals were identified and proven as carriers, ID'd as coronavirus. Now, what I read didn't say COVID-19, but it did say coronavirus, and that was the 30s. And this is very important point I'm trying to make. No one can make this virus simply go away. The CDC has managed to convince everybody two things: that we can handle this like we did smallpox, and where we could make this virus simply go away. Smallpox, which had one distinct function, it learned how to infect humans but had no ties to animals or animal hosts as carriers. That's why we were able to, and I'm saying we like I had a part of it, I didn't have any part of it, why they were able to make that specific virus go away. That is not going to happen with this, any more than it would happen with influenza, the common cold, respiratory viruses, or respiratory syndromes, or anything else that has animal reservoirs. So another reason you can't vaccinate your way out of this is because they are trying to do something which has already been tried and it just can't be done. Equally important is that vaccination changes none of this, especially like vaccines that are developed. And I would hope this public watching this would start asking itself serious questions before it considers taking the advice of the CDC, the NIH, or any state board of health. Why are we doing things about this that we didn't do for the common cold or influenza or respiratory syncytial virus? And then ask yourself, why is a vaccine that is supposedly so effective having a huge breakout in the middle of summer? Respiratory viral syndrome doesn't do that. It just doesn't do that. And to help you understand that, you need to know the conditions, or a condition that is called antibody-mediated viral enhancement. Antibody-mediated viral enhancement. And this is a condition that happens when vaccines just work wrong, as they did in every coronavirus study ever done in animals and in people, and in animals specifically. And remember, every lab rat that they tested the vaccine on died. Everyone. So in animals on coronavirus after the SARS outbreak, and done in respiratory viruses or vaccine manufactured as the wrong way, basically in which it wasn't done right. It was done, but it was for the dollar, right? It was all for the almighty dollar. So if it was done right for respiratory viruses, which has a very low pathogenic rate, where an immune system actually fights the virus wrong and lets the virus become worse than it would with native infection. And that's why you're seeing a mutation or a Delta outbreak right now. A really good virologist, a friend of mine, that did some studies that showed that 75% of the people who had COVID-19 positive symptoms, and those people who had, of all of those people that had COVID-19 positive symptoms, in cases recently, for example, in Massachusetts, I can't remember the city. It was Barn something, Massachusetts, Barn Noble. I can't remember. Nevertheless, 100% of the COVID outbreak were fully vaccinated people. It's the same in New York, Washington State. I'm in Louisiana, and Louisiana. Therefore, where's the reason? Where's the reason for treating any person vaccinated any differently than if you don't have a vaccine? If you've not, why treat somebody vaccinated? You understand what I'm saying? Why treat them differently than a person not vaccinated? You should also know that no vaccine ever stops an infection. In 2014, I was at NASA. I was working on another project, and there was an outbreak of mumps. I remember reading this. Maybe it was 2013. I can't. It's been a long time. The National Hockey League. The only people who came down with the symptoms were the people who were not vaccinated. Man, that sounds like a great argument for vaccine, right? But a question you should ask yourself is to know that half of the people who came down with this symptomatic disease had no contact with the non-vaccinated. So where did the individuals, or rather, where did they get the disease? And the answer was from the vaccinated individuals. They were carriers. Remember, no vaccine prevents you from getting infection. You get infected with the pathogen. Nobody has ever said this, but that's how you get infected, is through the pathogen. This is especially true of viral respiratory pathogens. So the CDC can't stop the spread. They cannot make these numbers that they planned on to the public to get better at a specific time, especially by doing any of the things that they're doing, because that the nature of viral respiratory pathogens, you basically can't prevent with a vaccine, because they don't do the very thing you're wanting them to do. And if you keep up and keep listening to what is being said, we will be chasing this the remainder of our life, or until we recognize that the Center for Disease Control and State Board of Health and the top medical advisors at the governmental levels are giving us very, very bad scientific guidance. And it's counterfactual. And there's a reason why. I don't know what that reason is, but there's a reason why. And that's why we're still fighting this 18 months later. Keep in mind, these vaccines were supposedly going to call this virus, basically stop this virus, and completely make them go away, according to the CDC, right? So vaccinated, after administered, did not have to wear a mask, didn't have to social distance. You could go to Walmart and walk around, and you were great, right? But suddenly, we managed to make a new outbreak of COVID-19 Delta in the vaccinated. And now it has developed into the middle of summer, when vitamin D levels are at their highest. By the way, the other thing that we missed on these vaccines and its restrictions to be considered were approximately 150 COVID-19 patients. And this, you can look this up. This is New York, the New Yorker or New York Times. 150 COVID-19 patients that were in hospital, vaccinated. the hospitals saw an increase in hospital stays, and these are all vaccinated, and developments of COVID-related symptoms and additional side effects. And these side effects were life-changing, and this is only in the last 33 days. Today's August 10th, 2021. So if you're going to discriminate based on a vaccine, you should also discriminate based on hydroxy, vitamin D, and probably previous infections, since there are so many studies that show that people who have recovered from COVID-19 infections actually get no benefit from vaccinations at all. No reduction in symptoms, and still get ill, except much quicker onset and harder symptoms, including pneumonia. There is no reduction in hospitalization as reported, and patients suffer 2 to 4 times the rate of side effects. And that's crazy. And these are vaccinated. Therefore, the policies that is being offered to us are based on, or are in total counterfactual fact. It's not really a word. Counterfactual fact. That's good enough. Look, thank you for your time. I hope that this has been informative. Share it. Share the truth. Also, don't take my word for it. Look it up. Everything is stated in this video is verifiable. It's easy to find. Google or Bing it. Thanks a lot. Bye.